Welcome to Living Outside the Matrix, the show where we examine important issues either ignored or misrepresented by the mainstream media. Hi there, I'm your host, Nigel Howitt, and on the show today, it's a great pleasure to introduce Dr Elmar Jung, a leading expert in holistic dentistry here in the UK, and we're going to be discussing the underappreciated problems of modern toxic dentistry and the often overlooked connection between oral health and overall health. And we're also going to examine some of the solutions around that topic as well. So, Dr. Jung, thank you for taking the time to join us today, and a very warm welcome to the show.
Thank you very much, Nigel. It's a pleasure to be with you. Thank you.
Wonderful. Perhaps you could start us off, Elmar, with maybe a brief introduction as to your background very briefly and how you got interested in holistic dentistry as opposed to the Main Street dentistry.
Well, as we all dentists start at university, it already started there where we had to use the amalgam fillings, and that was a bit of a conundrum where I thought it can't really be the right thing to do to put mercury in people's mouths when just a few years ago at high school we learned that mercury is one of the most toxic elements on planet Earth. So that was already the start to questioning that. But then you are told, well, yes, it is a problem before it gets into your mouth, and it's probably a problem afterwards when it gets out of the mouth. But once it's in your mouth, it's absolutely fine. And when a professor tells you that, then obviously, yeah, for a few moments you believe in that until you start noticing that there are certain symptoms from patients that can't just be due to their imagination or some other causes. And then you read more and you learn more and you come to the conclusion that mercury actually is the toxin that they tell you at school, and it stays a toxin once it's in your mouth because it's not an inert material that is there when it's amalgamated with all the other materials that amalgam makes up, which is silver, tin, and all the other elements. And so that was the start to say, well, we need to look where else we can go with dentistry rather than just intoxicate our patients. And so that was the main start to go into more of a holistic dentistry, and it then led me to the path of homeopathy, kinesiology, and yeah, as you probably know for yourself, when you start one way, you learn so many people, you learn many other different tests and methods, and yeah, that's just the way you go. And here, 30 or a bit more years after, you're here and giving that interview.
Excellent. Well, thank you so much for that. One of the things I wanted to mention also is this fabulous book that you've written, Shut Your Mouth and Open Wide, which basically summarizes a lot of your whole approach, and we'll obviously go into that today. But maybe we can start by examining some of these main problems with modern dentistry, and you've already hinted at one there, amalgam fillings. That's probably a big one for a lot of people, isn't it? Many people still have amalgam in their mouths. So can you maybe go into a little bit more detail then about amalgam and the problems and how to remove it and so forth?
Sure. I mean, from my point of view, we have a couple of main issues when it comes to dentistry. And one is what we just talked about, the toxins, and one of those is the amalgam. We have the infection, inflammation. We have the structural issues, for example. And so coming back to the mercury, I mean, the real problem is that when the mercury is in your mouth, it's not sitting there. What it does, it seeps out, it leaks out, it vaporizes out 24/7 all day long. And that increases when you chew, when you have hot food, when you grind your teeth, when you clench your teeth, when it comes together with other substances such as fluoride, and it also increases in vaporization or in coming out of the amalgam filling when you have different metals in your mouth. So if you have, let's say, a metal inlay or a metal crown, then the incidence of the mercury coming out of the amalgam filling is high 4 to 10 times higher than if you only would have amalgam fillings. And so by having the amalgam fillings just about 2 inches below your brain, it just vaporizes into your bloodstream, goes into your gut, and it's everywhere in your body. Then depending on where your weak spots are, that is where you might then find some problems.
Mm-hmm. So it's a sort of a constant drip feed of mercury toxicity, isn't it? Sort of daily, as you mentioned, every time you chew and have a hot drink. Yes. So you're constantly getting poisoned, aren't you? I suppose there must be some sort of cumulative effect, and that must weigh down the immune system, mustn't it? It must burden the body with a task just to deal with that, does it?
Absolutely. And it's exactly what you were just mentioning, the accumulative effect, because you don't drop dead from Monday to Tuesday when you get an amalgam filling placed. That's not the point. And that's also the big problem, because that is what very, very few medical doctors see. They just see the end effect of it, but never then draw the line back to, oh, have you been to the dentist and have they fitted some amalgam fillings 50, 20 years down the line? No, no one will ask you that. And so that is where our patients have become their own detectives, their own kind of researchers. What's going on with my life? Because that's not normal what I'm having, all these symptoms. And so, as you say, yeah, absolutely, it drains out every single day. And smokers, for example, they are even worse off because they constantly have a far higher temperature in their mouth. And so, yeah.
Gosh.
It comes out.
So that's obviously quite a widespread one. What about in your book? You really nicely lay out all of these problems, and you go on to talk about root canals and other things. Maybe we can discuss those, because they're quite common, aren't they? A lot of people, if you have a damaged tooth or a dead tooth, it's quite often recommended. The conventional dentist will say, well, how about a root canal? Can you walk us through some of the problems with that common procedure?
Well, it's a fantastic idea to keep a tooth in your mouth so that you don't have to have it extracted, for example, when it has a trauma, when it breaks, or when the tooth decays and the decay went into the nerve, so that you have to do something about it. So or you actually have 3 options. You can leave it as it is and wait what happens, which obviously is not the best option. And you can have a root canal treatment, which is the conventional way of dealing with that tooth. And most people say it's the best since sliced bread, because you can keep your tooth and nothing happens, because once the tooth is dealt with, when it's root treated, then similar argumentation to the amalgam fillings, it's fine, nothing happens. And again, nothing could be further from the truth, because that tooth will deteriorate, and people see that the tooth becomes darker. Often the tooth develops an abscess at the tip of the root, and what happens all the time, the tooth excretes toxins. It's actually not the tooth that excretes the toxins, it's the bacteria there. And where are the bacteria? Well, the bacteria, they hide in those tiny little channels that the dentist can't reach. Because what we do as dentists, when we do a root canal treatment, we treat the main channels. So the front teeth, for example, they have 1 or maximum 2 channels. Then the premolars, molars have 2, 3, 4, or 5 different roots and channels. So those main channels and roots are treated, and by people who are specialized in that, very well done, perfectly filled and sealed. But what about the rest? And every single tooth, and that's probably what not a lot of people know, every single tooth on top of those main channels has about 2 to 3, some say even 6 miles of tiny little channels in themselves. And that means, what's happening to those? They have not been sterilized. They can't be sterilized. They did research on that. Even when the teeth are out of the mouth, gone through sterilization, industrial sterilization, it's not sterile. So these are the ideal hiding places for bacteria, and especially for bacteria who like to be without oxygen, because oxygen is death for those bacteria. Mm-hmm. And those bacteria, they excrete toxins, and these are the toxins that then make or can make people sick.
Gosh.
And again, those toxins go out in the bloodstream, and what we see a lot is that combined with root canals, that people then have problems with their joints or all sorts of things. And we also have to say, not everyone experiences that. So it's important to really make sure that that person is susceptible to these kind of problems. There are methods to measure the toxicity of that tooth. And there are a lot of people who go through their life with their toxic teeth, and they compensate for it, because nothing else is what our body is doing. It's compensating. We're not craving for amalgam fillings or craving for toxic root canals or implants. The body deals with it. It compensates, and as long as it can compensate, it's fine. Mm-hmm. You might have some subclinical symptoms, but you get on with it.
Yeah.
And the problem comes when this compensation starts to falter.
Right. So it's really a sort of an issue of thinking in principles here, isn't it? And looking at the long term. And as you say, you don't have a dental treatment on Monday and fall ill by the following weekend. But 20, 30 years later, your immune system, maybe when it's loaded up with other factors and accumulated toxicity, it all sort of comes home to roost, doesn't it? It's interesting, what you say about the structure of a tooth, and maybe people don't realize that it's, got so many little holes and tiny little places where these anaerobic bacteria can live and thrive and produce their toxic what do you call it? Their toxic sort of end products, their wastes, and just as a result of them living, I suppose. Yeah. So let's move on to another one of the because the bacteria can be a problem as well in another place where they shouldn't accumulate in these infections in the jaw. Can you tell us a little bit about those? What when people have extractions or maybe wisdom teeth removed, perhaps they don't realise that they can often end up leaving some bacteria there which can grow in the bone and become a problem.
Yeah, what you're talking about is cavitations, what they are normally called. They are also called, well, they have many different names. And the most recent one, I would say, is fatty degenerative osteonecrotic jawbone, which is FDOJ, and it's named by Dr. Lechner. That is probably the most prominent researcher and active dentist in that field. Yeah, what happens here? When a tooth is extracted, then rather than just skipping the tooth out, what should be done is as well clean the area out. So remove the periodontal ligament, and oftentimes when a tooth needs to be removed, then there is some infection around the tooth. So it's important to remove all that soft bone so that everything, or as good as possible, is removed. Unfortunately, oftentimes that doesn't happen. And very often this is in the region where wisdom teeth are removed, because it's often difficult to get them out in the first place. And then the dentist is happy to have them out. And yeah, then they heal. That means the gum heals over the wound, and then inside where the bacteria have been left, those bacteria, they then form like a mucilage membrane around themselves. So nothing that you actually bring into your system, let's say antibiotics or homeopathic remedies, nothing will actually go into this cavitation. So the bacteria thrive, and the toxins that they excrete, they can get out and can cause problems everywhere else in the body. And so, yeah, it's very important that when you have a tooth extracted, that it's really done in a way that is properly done. And it's not only down to the dentist, it's also the question, how good is your immune system at the time of the extraction? Because that's the other point. If your immune system doesn't work properly at that time, then obviously you don't have the capacity to heal properly, and then this can happen as well.
Right. Okay. So another example of accumulating toxic excretions from bacteria. It's really interesting. Maybe, I mean, as I say, your book goes into a great detail with all sorts of these problems, but perhaps we can touch on one more that's probably most people are aware of, and that's the idea of replacing their teeth with false teeth and having what we call implants. I think the modern terminology. Can you tell us about the things that people need to be aware of and the problems with implants and maybe the procedure as to how they do that?
Yeah, I mean, again, implants were a godsend for people who haven't had any proper or their own teeth and could now get rid of the smelly denture, so to say, in those old days when Brånemark developed the first ones. And what we've seen over time is that the titanium, the material that normally are used for those implants, they have an issue. They, again, don't stay inert in the bone. There's a constant flow again of metals out into the bone, and we can see that on x-rays, and we can also see when we have to remove those implants that in certain areas where the implant is placed, there are hollow areas, there are soft areas, or there is even mash where the implant, the toxicology or the toxicity of those metals have destroyed parts of the bone. So how is it done? Well, oftentimes what happens, a tooth is extracted and then straight away the implant is fitted. So now I don't think that's a really good thing, especially if you had an infected area where the tooth has been. So one needs to be clear if the area is fine or not, if it's infection free. Mm-hmm. And we have a fantastic machine that works with that, which is the Cavitaus scan. And we can determine with that whether there is an idea of infection around the tooth, or we can fit a tooth straight away. Now, even if that's an option, I would still say have the tooth out, let it heal, make sure that everything is fine. After 6 months, do a Cavitaus scan, then see that everything is really healing very nicely, and then do the implant. And if you go for an implant, only go for a zirconia implant. And if you have a chronic disease, I would think twice or even 3 times of having an implant.
Right.
At all.
And what is the zirconia implant? Can you just elaborate for those people who might not heard that term?
Well, a zirconia implant is a non-metal implant. It's a material that is very biocompatible. And again, we need to make sure that it's for the right person. So it's important, if you have the option, to have it tested, test that the material is good. And still, if you test it, you don't know what's happening once it's actually in the bone. Mm-hmm. So there are lots of dentists who now only do zirconia implants, and they have great successes. The question is, how long does this success last? And It's not only to last for a few months or a few years. It should last for a long, long time. Yeah. And we know from a researcher in the Netherlands, he said that the incorporating of an implant into the bone, if it's a successful implantation, you call it about 60% of the implant is actually incorporated in the bone. The rest of the 40% have not really touched with the implant and the bone, and on average it's only 40%. So that means 60% of an implant hasn't even healed in properly to the bone, which is quite a scary figure.
I suppose that, it's very tempting for people to want to go for implants because in theory you can have all your teeth knocked out and you can have all these, you can have a perfect Hollywood set of teeth, top and bottom.
Absolutely, yeah.
If you've got the money, of course, they're very expensive. But again, it speaks to the long term, or rather the long term is where you have to consider. And maybe that we can tie that in with the next point that you make well in your book. And this idea of connecting our oral health with our long-term health. And many listeners will be aware that we're in a sort of an epidemic of modern chronic diseases. These aren't diseases that are short-term, acute, infectious diseases. These are diseases that we develop over years and decades. We actually, our bodies sort of make and develop and assist these diseases into being, which sounds crazy, doesn't it? So maybe you can help join the dots there with dentistry and all of these modern diseases, even autoimmune conditions. Can you just elaborate a little bit more on that connection for people?
Sure. I mean, if we look at how we get into this world nowadays, babies have more than 200 toxins already when they jump out of the womb. So we are already kind of preloaded. And with that, already the parents haven't been that well than their predecessors about 100 years ago. So with that comes the modern Western diet, the so-called civilized diet, which in effect is rubbish for most people, and they live on that, which lowers the immune system in the first place. So what we then get is chronic subclinical inflammation. And if we look closely, all chronic diseases have these chronic inflammation. And that chronic inflammation isn't just in your gut. That is probably where most people hear of it. But this chronic inflammation, when it goes around in your body, it can go in every single organ. It can go in your joints. It goes into your brain. And it also is visible in your gum, in your mouth. So what we have here is bleeding gums. We have swollen gums. We have pus coming out from the gums. So oral hygiene is very, very important. And what we see in the mouth is actually a mirror of what is going on in your body. So when we say we look in your eyes and we see your soul, if I look in your mouth, I know what's going on in the rest of your body. And it's really like that.
Right. So a lot of people obviously gum disease or poorly maintained oral hygiene just through not brushing regularly. I suppose that this must all contribute to an accumulation of bacteria that really shouldn't be there, because there's a big tendency to think that bacteria are really the enemy. But is it fair to say that it's just when they are allowed to thrive and prosper in areas where they shouldn't ever get, for example, you mentioned in the root canal situation, that's really when they become a problem, isn't it?
That is exactly how I see it. And I mean, if we go back to the original war between Pasteur and Beauchamp, Pasteur always saying it's the microbe that is the problem, whereas Beauchamp saying, no, it's the environment. And that is my point of view as well. It's the environment. And I think we all know that Pasteur in the end agreed to that. So yes, it's really what is given to them, and they are opportunistic critters, as I call them. And we need to make sure that we create the right environment for them. Also, what we have to be aware of, that whether it's tooth decay or gum disease, it's not something that strikes at random or you get from now to tomorrow. It's, again, as well, a systemic disease.
Well, maybe we can. Another thing I want to touch on, because you mentioned in your book the emotional connection, but it's fascinating that you mentioned the sort of terrain theory versus germ theory from Louis Pasteur, because with the modern popularity in recent years, over the last 4 or 5 years or so, gut health has been very much a fashionable topic, if you like, in health circles, and we've had this growing appreciation of the need for a broad and diverse gut microbiome or body microbiome, and a healthy gut, basically, because of the fact that the immune system is largely in the gut. So holistic dentistry, am I right in saying, is very much sort of subscribing to terrain theory then? It's a question of eliminating toxicity and making sure that the bodily terrain is appropriate to the right kinds of bacteria so that the pathogenic bacteria don't overgrow. Is that a fair assessment, do you think?
Well, I would definitely say it's a fair assessment in the regards how I look at dentistry. I can't speak for anyone else, and holistic dentistry is not a secured or patented label. So there's a lot going on under the head of holistic dentistry, and it's oftentimes a bit abused. So saying I'm not using amalgam, therefore I'm a holistic dentist, I think that is often how it's used. So absolutely, I mean, the gut is so important, and you can spend thousands of pounds on the best supplements you want. If your gut can't assimilate, well, then better go on a holiday. It really is like that. We need to look at that from a very different point, because the gut is not just from A to Z. The gut has different areas. So if we provide something for the gut to become less inflamed, we need to provide fibers for those different areas. We can't just throw in fructo-oligosaccharides, which are very short chain fibers. We need to provide for all the bacteria there, so that all the good bacteria in every single part of the gut can thrive.
Mm-hmm. Fascinating, isn't it? It again speaks to this long-term issue where I think people, are encouraged to think, our whole culture is very sort of short-term in its thinking, and I think certainly with health matters, the modern toxic dentistry very much overlooks the long-term consequences, isn't it? Sort of quickly fix the problem and get out of the surgery and we're done, sort of thing, without an appreciation of what your health is going to be doing in 40 or even 50, 60 years. So a very important consideration, and thank you for making that distinction that holistic dentistry, there may be all sorts of different ways to practice it under that broad umbrella. That's a really important note. Maybe you could elaborate, Elmar, on the emotional connection as well, because you go into that in some detail in your book.
Yeah, what we see over the last few years, that the influence of the tooth organ connection plays a huge part in the process of healing. And we see that especially when we do tooth extractions, and that's my main specialty, taking teeth out. And we see let me start the other way around. Every tooth is connected to an organ. So if we, for example, take a front tooth out, the front tooth is connected to the kidney, bladder, urogenital system. So if there is an issue with the kidney, and that doesn't necessarily mean an issue in the kidney, there could just be a issue that is related to the kidney, and the kidney relates in terms of emotion to anxiety, to depression, to those kind of emotions. If there's a trauma sitting on the kidney with that emotion and it's not dealt with, we know that the healing of that extraction wound will not be as fast, as good, and as proper as it could be when that would be dealt with. And that is what we see a lot of the times. And that is why we included in our treatments now what is called light kinesiology. And we work with biophoton mirrors. And that brings not just emotions, it really works with all sorts of blocks, mental, physical, spiritual, whatever there is, that comes up in those 2 hours of session. And we have tremendous results with that. So emotion play a major part. We're talking about repair. Dentistry, medicine is all repair medicine. It's not, as you rightly say, it's not about looking at the whole person anymore. That was, I mean, I still remember my GP. I mean, he knew the whole family, he knew what's going on, and he said, well, you just do this and that, and he put your head in the right position again, so to say. But nowadays, I mean, if I see here in the UK, GPs have 7 minutes for the patient, that it can't be a proper service to the whole person. It is something to, as you say, get them out of the surgery as fast as possible. Maybe, or not maybe, but write a prescription so that you tick the box for having written a prescription. So yeah, we need to come back to a system where we really, from the start, when we come out, or even before perception, that we get the parents healthy so that they then create healthy kids, and that the kids are looked after in a really healthy way. To do preventative medicine, preventative dentistry.
Yeah.
I think this is where we need to go.
Yeah.
Otherwise, we can spend billions on the NHS and it will never make any difference, because we all have the problem of those silent inflammations, and they just grow and grow and grow. And when they then come up, the bucket is full. No one knows where they come from, and no one knows where to pull the plug.
Yeah, it's interesting, isn't it? Because, you know, this sort of terrain theory versus microbe theory, again, sort of is maybe responsible for the lack of awareness of the toxicity. And you know, as you've explained, we're very susceptible to a lot of forms of toxicity from modern dentistry and the secondary effects of the bacterial excretions, of course. But it's really important, isn't it, to broaden out our whole understanding of health, and sort of, you know, maybe consider a whole new way of looking at health, a whole new health paradigm in terms of the holistic need. Because I agree, you know, my doctor when I was a child, again, knew everything about the family, whereas these days you'd be lucky to have a GP, general practitioner here in the UK, who knows anything about you at all, let alone the rest of the family. And it really is
the same one every single time.
Yeah, it really is a sort of a blinkered in, sort of highly focused look, isn't it? Or method, I should say, in modern health and dentistry, which we need to change from. But maybe we can move on to some of the solutions, because obviously, you know, we want to be solution orientated, and certainly with the problems that you've already outlined, the main four. There are others in the book, as I mentioned. Things like amalgam fillings. There are alternatives, aren't there? There are relatively inert or completely inert, safe compounds that can be used to fill cavities in teeth, aren't there? Can you maybe tell us a little bit about that? And then also for things like root canals, when people have teeth extracted, that can be quite a scary proposition, because nobody wants to walk around with gaps in their smile. So maybe you can share as well some of the amazing advances in modern you know, dentures and so forth, because there's really you know, we've come a long way, haven't we? And there's, you know, you don't need to walk around with a gap in the front of your teeth anymore. So perhaps you could you know, start with amalgam fillings, and we can cover some of the solutions.
Sure. I mean, well, we also need to look into, we can take the amalgam fillings out in a safe way, and it's important that it's done in a safe way, because otherwise it's safer to keep them in. So you need to follow a certain protocol, and the IOMT has produced a protocol which is called SMART, Safe Mercury Amalgam Removal Technology. So that is very important that this is followed, so that the patient and staff are really protected when taking the amalgam fillings out. So that is one thing. And the other thing is, then you can put in what we call the white fillings, the composite fillings. And there are hundreds of those fillings on the market, different ones. And it's important to look at their ingredients, because otherwise you just remove one poison for the other. The other poison will not be a mercury, it will be a hormone disruptor like bis-GMA, Tegma, these kind of things. So you need to look for materials that do not have that. And again, it's a bit of a research, and that's probably also something I'd like to say. We also have to take the responsibility for our health in our own hands.
Sure.
It's not just about going to our doctors and say, make me heal and healthy again. It's about us researching, us changing our lifestyle so that we actually get to a foundation that provides for health. And so this goes on with then researching what are healthy solutions, what are possible options for composite materials. And I use two different companies, one from Switzerland, one from France, Aramco and Elsodent. And I use them since many years, and they are free from those things.
Wonderful.
So there are options. And we just have to see nothing is without harm.
No.
Whatever we do, whatever material we use, it can always be a problem for the odd person. So, but on average, if we make sure that it's the least problematic material, then at least we've done our part to do so. In regards to filling gaps, well, yeah, absolutely. There are dentures nowadays. There are, for example, if you have only one front tooth missing, a Maryland bridge that can fit at the back of the neighbor teeth with just a little wing being bonded to that tooth. So you don't need to drill that much from that tooth, and you still have the options or the goodies from both sides. You have something that is fixed, and you have something that is not invasive, not that much invasive as a proper bridge would be. And dentures, they can now be made in all different sizes. It's not just the huge, big, all-covering, smelly denture that our grandparents were used to have. No, they're tiny little single-tooth dentures that clip into areas that only cover that area. And of course, they come with disadvantages because they sit on the gum can recede. And the question is, what are we looking for? Are we looking for our health? Are we looking for function, cosmetic? And so we need to see what is the most important part. Now, if you have a front tooth missing, you want rather something that is fixed, whereas in the back area, as long as you can chew with it, I wouldn't be really bothered whether this is fixed or not. For me, it's more about, does it help? Does it keep the teeth in place? And can you use it? Because my credo is do as least as possible. So, because every time I drill a tooth, it's a trauma to the tooth, no doubt, no matter.
Yeah.
Always is.
Yeah, so you are sort of trying to intervene as little as possible. That makes very good sense, doesn't it? And I suppose with these cavity infections, it's possible to as you said, when people have their wisdom teeth extracted, it's possible to end up with an infection that could be hidden in your jawbone that you don't even know about, and with things like this condition, trigeminal neuralgia, where you can have immense pain in your jaw nerve. I know two people actually that have this condition. Can things like that be attributable to these jaw infections? But my main question is how would people deal with those? How would they even know that they've got them? Is it a question of analysing any chronic health conditions you have, and then maybe addressing your oral health and your dentistry, and perhaps visiting a holistic dentist like yourself to investigate further?
I think with all chronic diseases, we need to look where is the cause. And most of the time, the cause is, as I mentioned a couple of times now, inflammation. And that inflammation can sit everywhere. It can sit, and most of the times with most people, it sits in the gut, and it can sit in your mouth. And so the visit to a dentist is definitely one of the first I would do as a chronically ill patient, and find out what is actually going on. Because those cavitations, root canal treated teeth, most of the times they don't cause any pain. They don't cause any swelling, any redness, anything that would relate to what we call an infection.
Yeah.
So those infectious symptoms, they are totally missing. They are sitting there. You don't know about it. And if you go to a conventional dentist, they will often not even know what a cavitation is, leaving alone how to detect them.
Yeah.
So you need to find a place where they can do, where they know about it, and whether that is with a Cavitao. The advantage of the Cavitao or Cavitat test is that it's an ultrasound scan that works totally without any harmful radiation. Other dentists use CT scans where they then analyze the scans and can diagnose what's going on there. So the Cavitao scan doesn't actually diagnose anything. What it does, it verifies, it checks and sees the density of the bone, and due to the density of the bone and the clinical symptoms and what we see on the OPG X-ray, then we can make a conclusion of what is going on in the patient's mouth.
Fantastic. So that's brilliant, isn't it? Because if you have any sort of long-term chronic illness conditions, which obviously a lot of people have, and perhaps this is more significant for people, in their 50s plus, you can then visit dentists such as yourself, and this Cavitao scan is a really useful tool, isn't it, in checking the bone. As you say, it measures bone density. So without any invasive procedure, an X-ray is very, very minorly invasive, isn't it? That you shouldn't have too many of them. But an X-ray and a Cavitao scan, you can sort of join the dots with symptoms, as you say, and you can get a good idea if there is an infection there that might need to be dealt with. That's fantastic, isn't it?
It's brilliant and really reduces the radiation of people massively, because a CT scan is so much more radiation than a simple OPG X-ray. So I'm really grateful that Dr. Lechner developed that machine. That's brilliant.
Excellent. And I mean, just moving on with solutions as well. In your book, you have a chapter on sort of lifestyle choices, essentially. And I think it's fantastic because it ties into what you were saying earlier about the need for us all to take responsibility for our health. And the wonderful thing that I've found, in the more I've looked into health, is that it is something that you can take responsibility for. The one of the few freedoms that we all enjoy is the freedom of what to put in our mouth. And diet is a huge one, isn't it? But you also go into, in your book, things like hydration and what are the other ones? There's hydration, there's diet, there's sleep. Maybe you can elaborate on some of the others, because there's a whole raft of areas where people can actually do something. Nobody's preventing you from doing these simple measures, and they can all stack up to be part of the solutions. Can you share a few more of those other ones that I haven't mentioned?
Yeah, I think the most important one is hydration, because we need to drink, we have to drink, our body needs water en masse. And so it's very, very important that you don't just open the tap and drink from there, but that you have a really good water system to reduce the stuff that comes out from your tap. And I use, since many, many years, the Berkey water filter. There are many others on the market for sure. That is just one that you can take around with you. It always comes up very, very good in even outdoor surveys. So that is something you can put in rainwater and even water from the street in it, and you get out very good water. It filters out plastic, hormonal stuff. It's impeccable. It's really great, and it's not a lot of maintenance. Berkeyfill is a UK brand, and they are brilliant. They have shower heads also, so to filter out the chlorine, because yes, we can drink good water, but if we then shower with the other, then we still get it on, because our skin takes it on, which is very important to make sure that this doesn't happen. Then breathing is one issue that a lot of people just take for granted. Yeah, okay, well, if I don't breathe, I'm dead. But there's far more to breathing than just that. You need to breathe very deeply. So you breathe from your stomach, even deeper from a diaphragm. And there are many exercises you can find online. It's very important, because if you breathe deeply, then you get more oxygen into your body, and more oxygen into your body means more oxygen into your blood, and more oxygen into your blood means more oxygen into your organs. So all your organs will benefit from that. And in opposite, when you do the shallow breathing, then you don't get a lot of oxygen in, and also you don't get a lot of the bad stuff out of your body. So therefore, deep breathing is very, very important. Sunshine is also an important part, because sunshine is that part of our life that we need a lot to build the vitamin D. And in the UK, most people, unfortunately, are totally depleted in vitamin D as they are in iodine, for example. So having time, taking the time to be out in nature, to go on without socks on the ground, to ground ourselves, these are things that help your body massively without we really, well, I don't feel it. A lot of people do feel how this grounding helps themselves. So having sunshine, having fresh air is very important. And one of the main things is reduce the influence of Wi-Fi, iPads, iPhones, these things. And a fantastic book to get an idea of what electricity is actually doing to us is Arthur Furstenberg's book in The Invisible Rainbow. Okay. Absolutely brilliant. I mean, it's incredible what kind of experiments 200-300 years ago already have been made with electricity, and the results they came up with, how plants react to electricity and how you can stimulate or stop them from growing. This is an eye-opener, and everyone who is in front of his telly 24/7 or has a telly in his bedroom or sleeps with his mobile phone beside the bed, highly, highly recommended. I think you will throw your mobile phone out of the bedroom. It's dangerous.
Yes, absolutely. I couldn't agree more. It's interesting because there are a number of components to health, a number of lifestyle choices, and they as you mentioned, there's sunshine and breathing. A couple that perhaps people don't necessarily think of. Gut health you already talked about a little while ago, and that was one that you mentioned in your book as well. But it is really important, isn't it, to adjust our lifestyles in all of these little respects, and there are so many little areas where we can do something about it. You can switch off your Wi-Fi, and you can connect your computers up with a wire for actual better security and faster service and all of these things. There are many advantages, not to mention the fact that you're not irradiating yourselves. So it's really empowering to hear you share some of these things and aspects of the solution, not only to oral health problems, but obviously the greater goal being our overall health.
Absolutely. And I think it's also important to see that in respect to our little ones. What do we do to our children, to our newborns, when we bring them into an environment full of electricity and full of toxins, and then feed them food that is microwaved, which makes them dead, but also has a cumulative effect on the ones who eat the microwaved food. So we can do, as you say, we can do so many things by avoiding a lot of things. And then obviously when we eat things, where do we source them from? If we have factory farmed meat, for example, those animals, they don't have a life. They're just bred there, full of antibiotics and stress hormones. This is what you get when you buy it, and people just want to have cheap food. It doesn't work like that. If you want quality, you have to pay, whether that's for a car, for shoes, for clothes. It's the same for food.
Yeah. It's fantastic, isn't it? Again, you in your book, you allude to the key areas of things to avoid. I think you mentioned wheat. You recommend minimizing dairy, or the fact that it should be raw, and yes, organic, grass-fed, and all of these other principles around it's basically an awareness of, as you say, a quality of food. We have to, again, sort of zoom out a little bit and think long term, think in principles, because I think when diet's a really difficult one, isn't it? Everyone sort of thinks, oh, what should I eat? What shouldn't I eat? But when you strip it down to principles, just follow these guidelines in principle, that makes it a lot easier, doesn't it? Avoiding sugar is one that I know you mention in the book. Wheat and things like this, which is packed with glyphosate, all modern wheat products. There's a lot we can do, isn't there, with respect to diet? Do you think that supplements are worth considering?
I think supplements are a no-brainer. Unfortunately, nowadays, even if we have organic food, we will not sustain our body without proper supplementation. We just don't get it, because even the organically grown plants are not grown on soil that is the same as it was even 20, 30 years ago. It's depleted, and it's depleted more and more. So we have to supply our body with some supplements. And first of all, as I mentioned at the very beginning, it's important that we create an environment in ourselves so that the supplements actually can work. Yeah. Because that is what we see a lot of the times. And we now have introduced a test to check the omega-3 to omega-6 ratio. And it's absolutely amazing. Almost 100% of the tested people are out of balance with that. And what does that mean? That means that we have already, by just this measurement, we know that those people have inflammation, have chronic subclinical, most of the time, inflammation. So we need to first get rid of that. So we need to get oil to balance that properly. And then we need something that helps us in the gut to help in the gut make sure the inflammation is reduced there. So, and then once we have that, if we then find a multi-mineral, multi-vitamin product that can cater for that, that is especially also then containing beta-glucans, because the beta-glucans, these are the ones that actually help with even further reducing the inflammation. I think that is when we then start to really benefit from things.
It's interesting that you mentioned oils there, because I recently discovered the harm in this out of balance of omega-6s, omega-3s. Is that too much of a simplification? But the inflammatory oils versus the uninflammatory oils. Maybe you can elaborate a little bit. But I recently learned how harmful the vegetable oils can be, because they are they're not saturated. They're usually polyunsaturated, and the oil or fat molecules, depending of course whether it's liquid or solid, are very susceptible to oxidation and becoming rancid. And so when they're cooked with, in people's diet, the oils, actual oil molecules are damaged, and that causes a problem when we eat them. We're effectively eating, toxic products. And I suppose this must be in all cakes and biscuits and all of these processed foods that contain anything cooked in a vegetable oil. Can you remind us what the test was? You say you can actually do a test to check somebody's level of omega-6?
It's the test that checks the ratio between omega-6 and omega-3. Every GP can do it. We do it in combination with this new protocol that we have established, where we then supply the oil and the gut probiotic fibers to the patient and the multiminerals. But every blood lab can do the test, and you should aim for omega-6 to omega-3 max 3-to-1, better 2-to-1.
And what is the ratio there of which one's the omega-3 and which one's the omega-6?
Omega-6, 3-to-1 omega-3.
Okay.
If you can do 2-to-1, even better. And every single oil, or all those different omega fatty acids, they have their purpose. We need them. It's about the ratio.
Right.
And the ratio at the moment with most people is omega-6 is very, very high in them, whereas omega-3 is very low. And what is also very important to know, and that is what I learned from Dr. Paul Clayton, who is in that system for a long, long time and has written a couple of really interesting books, and you find them online with a couple of YouTube videos. Dr. Paul Clayton, is that he went into conferences where those supplementation or supplement companies were, and he researched on different forms of oils and found out that a lot of them, they are rancid.
Yeah.
From the start, when they even before they come to the supply chain, and they are then still rancid when it comes into your body. They confronted them and they said, well, yeah, we know that, but it's a good business. Yeah. So again, supplements, although they mean health, doesn't necessarily mean there is not anything going on that is against your own health. Yeah. Might be good for their health in terms of healthy
profits.
But yeah. we need to take responsibility. We need to look, what is it that we get, and make sure that we get the right quality.
Yeah. I was talking to Dr. Natasha Campbell-McBride recently, and she pointed out how a lot of the vegetable oils in the very manufacturing process, in just the process of getting the oil out of the seed, whether it's sunflower, safflower, or rapeseed oil, a lot of these oils, just the extraction process actually damages the oil beyond any potential usefulness, and it renders it, as you say, rancid and therefore ultimately toxic to the human body if we ingest it. And as you say, when you add in the economic factors, you can be absolutely sure that when you eat out at a restaurant or when you eat any processed foods that are assembled in factories, the cheapest oils will be used, and they will be these damaged vegetable oils. So it does speak to avoiding processed foods, doesn't it? And indeed eating out. I never eat out anymore unless I can find a very specific restaurant that will cater for my, high standards.
Yeah, I think what's also important when you eat, and that is what a lot of people lost, they just sit down, swallow down their stuff, and then go on to the next task. We often don't take the time to really sit down, to appreciate our food, to appreciate where it came from, who gave it to us, whether that's an animal, a plant, who was in that supply chain and who created it for us, and actually blessing the food that we take, and then really chew properly, not just having it in the mouth and gulp it down, but really chew 20, 30 times, and you'll see your plates don't need to be that full. Yeah. If you chew properly, you produce so many more enzymes to produce your food properly, and you will be full before you think you're full. And so that is a really, really big thing. A lot of people eat too late, they eat too fast, they eat too much, they eat too fat. And so again, a lot of things you can change, and you will see within months or even weeks what changes can happen. Oh yeah, that's a very important thing. What we found with the protocol we introduced, within days we saw changes in people's digestion. Even when they had constipation, they went to the loo maybe twice a week or so. We had a 87-year-old patient who within 4 days on it is now regularly on the loo. So that's also a very good sign. How often do you go to the loo on a day, and how much toilet paper do you use? How much toilet paper do you need to clean up after it came out?
Yeah.
If you need a lot of toilet paper, that means something's not digesting properly. You don't get this mucilage layer around it that kind of just brings it out. There's again something not working properly.
Yeah. Well, thank you for that. It's really great to hear you say, the importance of chewing, the very, and indeed just setting, the original idea of grace, I suppose, sitting down at a table and just, sitting still just for 30 seconds. I mean, I'm not a religious person myself, but I'd certainly recognize the value in everybody sitting down, maybe even holding hands around a meal before we start eating, before we wolf it down, just gathering our thoughts, and calming the stomach, and as you mentioned in your book, your body, your brain sends all sorts of signals in anticipation of food, that now the digestion process is going to begin right here with how much we masticate, making sure that we've chewed our food up thoroughly. I think that's a hugely overlooked component, isn't it, to proper digestion, to make those nutrients actually available to the body.
Absolutely, and you don't need to be religious to do that. It's just common sense, because what we give to that food just before we swallow it is energy. And even if we don't feel it, it's there, and we give it into it. So we take in our own energy combined with that from the food. So yeah,
Fantastic.
It's very, very important.
Yeah, excellent. Well, we've covered a lot of territory there, Elmar. I think it's fantastic. Is there anything you wanted to say, by way of wrapping it up? I know you mentioned taking responsibility, but is there anything you wanted to say in closing, as well as maybe some details of where you practice, and maybe how people can get hold of you, and maybe even pick up a copy of this excellent book that you wrote?
Okay, well, the main thing really is that we need to look to reduce our inflammation, as I said, that we chew our food properly, and that we have a really good oral hygiene. I think these are things that we can all do. There are tiny little steps, and it's really, in the book, it's pointed out what you can do with tiny little steps, and you will achieve massive differences in your health. If you become a patient of ours, the book is yours. You get it as a complimentary copy once I see you. Otherwise, you can get it on Amazon, and I love to read your reviews there. Otherwise, soon we'll opening a shop on my website, so you can buy it there. And my practice is in Southampton. If you want to get hold of us or get some more information, that is on www.dr-elmar, that's Echo Lima Mike Alpha Romeo Jung.com, and the email is contact us at dr-elmar-jung.com.
Fabulous, great stuff. Well, I've had so many people ask me about various issues to do with teeth, so it's great to be able to point them in your direction, assuming, of course, that they're in the UK or maybe in close mainland Europe. But thank you so much, Elmar, for a fantastic presentation of the essentials, I think, of this connection between health and our teeth. And most specifically, I think some people will find it very helpful, if they are suffering from any chronic health issues, to consider the state of their jaw and their teeth and their oral hygiene as they attempt to get to the bottom of their own chronic health issues, particularly maybe even autoimmune issues and so forth. So I think that's a very great tool. And with your cavital scan system, non-invasive means of checking these things out, I think that's a very valuable tool. So thank you for sharing that with us. And thank you for your time today. And for listeners, I do hope you got some value from this, and please check out the website lawfulrebel.com, where there's loads more there. There'll be links to this podcast interview, and all sorts of links to Dr. Elmar Jung's work will be beneath this video, and indeed on that podcast page on the website. So thank you so much for listening, everybody, and do join me again for another episode of Living Outside the Matrix.
Change you want to see.